Great, thank you and good morning. My name is Michael Isaacson. I'm Assistant Director of Community Health at the Health Department. And I just want to share, I was asked to just share a little bit of background about how we got to where we are with this. So first off, the issue of mental health and substance use continues to increase as a problem affecting Kane County residents. For the community health assessment and current community health improvement plan, which actually I believe is on the agenda today, behavioral health was identified as the top need that our residents are facing. We all know that with COVID, the behavioral health pressures that are on our residents have only increased. Our schools and workplaces are seeing increased reports of anxiety, depression, absenteeism. Unfortunately, over the past year, we saw a pretty significant increase in suicide among those under 30. We saw about a 13% increase in fatal overdoses from 2019 to 2020. We're still evaluating the full 2021 data, but it's not looking positive either. And then, unfortunately, as we see an increased need for services in our community, we're seeing more strain on the providers. So as Ms. Baker and many others have commented to the board, we have fewer resources to help people in a time where we have much greater need. So there's a lot of exciting things underway. I do want to acknowledge the ARPA committee and the full board for taking this issue on. Historically, Kane County has not financially put money in to support mental health. And so I think the decisions that have been made to support this important effort right now are really important. Next slide, please. So how did we get to the 6 organizations? The decision was made that there was going to be a process where funding could quickly get out into the community to have as dramatic an impact as we could, as quickly as we could. So first we looked at what area needed the most help. We conducted focus groups with community members, with organizations. The board hosted listening sessions, and then also through the Kane County Behavioral Health Council, we conducted formal surveys with the providers in the community. In all of those, we clearly heard that staffing is the #1 issue that we're facing right now. So in short, when community members need services, there's frequently not enough people to serve them, which means people have to wait even longer. So then we identified 6 organizations that serve as our community mental health centers and our safety net substance use treatment providers. So these organizations are serving a lot of our Medicaid population and our diverse communities who may be facing extra pressure during the pandemic. Next slide, please. So this is just a handout showing each organization's budget. We have, once we determined that these 6 organizations would be a good way to quickly get funding into the community so that we can increase access to mental health and substance use services. We worked with these groups and as Ms. Baker had mentioned earlier in her public comments, we reached consensus with this group. So even though in reality, these organizations are competing for some of the same people, we determined that it would be better for the community as a whole if we all went forward in the same page. So you can see we agreed on a common funding mechanism for how we could both recruit and retain staff. So this is the budgets that were submitted as part of the ARPA grant application. And next slide, please. And finally, just what is the impact in conversations with these organizations and in their applications? Unfortunately, we've seen that wait lists in some cases have increased by 10 times. So where maybe before 25 people were on a wait list, now well over 250 people are on a wait list. And in some cases, these are critical services that people need. So these aren't just things like you're putting off painting your living room. These may be a 16-year-old who's in crisis and desperately needs treatment. We can serve them in the emergency room, but when they get out, they need more care. And because of the staffing strains that are on our organizations right now, that's very hard to obtain. We have well over 200 job vacancies for people who are directly providing these services just among these 6 organizations. One of the respondents said that their turnover has increased from an annual average of 7.3% to well over 36%. And one reason for this is not only the regular strain that we're all experiencing with this pandemic, but these jobs, we require people to have advanced training, advanced schooling. We're not paying them as much as what they could make in the private sector. And you know, we're not going to compete with the private sector dollar for dollar. But these are jobs where people are called out potentially at all times of day or night. They're going into people's homes in very stressful situations. And we're finding that right now, with all the additional pressures that are on everybody, it's just really hard to retain staff and to recruit staff. So just a couple quick examples of things that are going to be specific programs supported with this grant. We do have, through these organizations, 24-hour mobile crisis response, 24-hour crisis lines, individual and family and group therapy, medication-assisted treatment for substance use disorders, psychiatric services, residential services, outpatient substance use. These are just examples. And again, this funding is really foundational to support all of the behavioral health efforts that these organizations are providing. So just wanted to share a little background. And again, I really want to thank the leadership of the committee and the full board for investing in this, because I can tell you from what we're hearing from our schools, what we're hearing from our families, this definitely is an area that needs much more support. Thank you.